You walk past your cat and notice something's off. Maybe they didn't come for breakfast like usual. Or they're hiding, twitching their tail, making a noise that doesn't sound right. And you start asking yourself the question every cat owner has faced at some point: is this serious? Or am I overreacting? Cats are hard to read. They don't whine like dogs. They don't always show pain the way humans do. They're subtle, independent, and, frankly, pretty good at pretending they're fine. But when a cat is sick or in pain, waiting too long can make things worse. Much worse. So how do you tell the difference between a quirk and a red flag? How do you know when it's time to call the vet? Let's start with one of the biggest indicators: changes in behavior. Your cat has patterns. You probably know when they eat, where they like to nap, how they react to certain sounds or people. So if that behavior shifts suddenly, if a social cat becomes withdrawn, if a quiet cat becomes agitated, if a curious cat stops exploring, that's a sign. Behavior is the first thing to watch. A healthy cat doesn't hide for long stretches of time. They don't suddenly start growling at you or flinching when touched. They don't go from purring in your lap every night to sleeping under the bed for days. When that change happens, it's not about personality, it's about pain, stress, or illness. Another sign: changes in appetite or thirst. If your cat suddenly stops eating for more than 24 hours, that's a reason to call the vet. Even if they seem okay otherwise. Cats who stop eating can develop a dangerous condition called hepatic lipidosis, fatty liver disease, which can set in after just a couple days without food. It's most common in overweight cats, but any cat can get it. On the flip side, a sudden increase in hunger or thirst could mean something else is off. Conditions like diabetes, hypothyroidism, and kidney disease often show up first through increased drinking or more frequent urination. If you're refilling the water bowl more than usual, or if your cat starts peeing outside the litter box or soaking through it more than normal, it's time to ask why. Speaking of the litter box, changes in urination or defecation are one of the clearest signs something's not right. If your cat is straining to urinate, making frequent but unproductive trips to the litter box, or crying out while going, that can be a medical emergency, especially in male cats. A urinary blockage can become life-threatening in a matter of hours. Don't wait. If you see any of those signs, go to the vet immediately. Loose stool, constipation, or blood in the stool also need attention, especially if it lasts more than a day or is paired with lethargy or vomiting. One isolated episode might not be serious, but ongoing changes in bowel habits aren't just a digestive issue, they're a signal that something deeper is going on. Next up, vomiting. Yes, cats sometimes vomit. A hairball here and there isn't unusual, but repeated vomiting, especially food, foam, or bile, is not normal. If your cat is vomiting daily, more than once in a short time frame, or if the vomit contains blood or strange material, they need to be checked out. Don't assume every vomit is just hairballs. Chronic vomiting is a sign of digestive disorders, kidney problems, infections, parasites, or even something as serious as cancer. It's never just normal, unless your vet says so. Let's talk about energy levels. If your cat is normally playful and starts sleeping 20 hours a day, that's not laziness. If they don't jump up to their usual perch, stop chasing toys, or move slower than usual, pay attention. Lethargy is one of the most overlooked signs of illness in cats. If it lasts more than a day or two, or comes with any other symptoms, it needs a closer look. Then there's the opposite, restlessness. If your cat can't seem to get comfortable, is pacing, panting, or vocalizing more than usual, that can signal pain or discomfort. Cats in distress sometimes become hyperactive or unusually clingy. So again, the key is watching for sudden shifts in behavior. Another subtle sign is grooming changes. Cats are usually meticulous groomers. If your cat stops grooming, their coat may start to look greasy, matted, or dull. That's often one of the first signs of discomfort or disease. On the other hand, over-grooming, especially in one spot, can indicate skin irritation, parasites, allergies, or even psychological stress. Bald patches, scabs, or red, inflamed skin are all signs it's time for a vet visit. Watch the ears and eyes too. Discharge, squinting, or redness in the eyes could mean an infection, injury, or allergy. Ears that look dirty, smell strange, or are constantly scratched may have mites, yeast, or another problem that won't clear up on its own. Also, check the breath. Bad breath isn't just annoying, it's a warning sign. Dental disease is one of the most common yet most underdiagnosed conditions in cats. Left untreated, it can lead to infections, difficulty eating, and systemic illness. If your cat's breath smells sour, rotten, or unusually strong, get their mouth checked. Pain isn't always obvious. Cats don't cry out or limp unless they're in serious discomfort. But if they flinch when touched in certain areas, avoid being picked up, or seem unusually tense when walking or jumping, that's their way of saying something hurts. Watch how they walk. A limp, a stiff gait, or even a slight tilt of the head can signal nerve issues, joint pain, or neurological problems. Don't wait until it gets worse. Another overlooked sign is weight loss or gain. If your cat looks thinner, feels bony around the spine or hips, or if their fur starts hanging differently, they may be losing muscle mass. That's not always about food. It could mean hypothyroidism, kidney disease, cancer, or chronic inflammation. Weight gain, especially a swollen belly, could mean fluid buildup from heart or liver disease. Sudden changes in body shape are worth getting checked out, even if your cat is still eating well. Let's not forget unusual vocalizations. If your quiet cat suddenly starts yowling or your talkative cat goes silent, that change means something. Excessive meowing, especially at night, could mean pain, disorientation, or hormone imbalance. Sudden silence might signal fear, discomfort, or neurological issues. And here's something cat owners often don't think about: gait changes after jumping or playing. If your cat suddenly avoids high spots, stops using certain limbs, or limps after a landing, it might not be a pulled muscle. Cats are good at hiding trauma. A fall from a shelf or window can lead to serious internal injury even if there's no limping or external sign. Sometimes, the problem isn't a dramatic symptom, it's a pattern. Recurring mild issues that never fully go away, like soft stool, sneezing fits, or occasional vomiting, can be a sign of chronic illness that's just beginning to show. The earlier you catch it, the better the outcome. Don't ignore something just because it's not constant. It's also worth mentioning behavior changes linked to the environment. If your cat starts spraying, scratching furniture they've never touched, or acting aggressive with other pets, it might not be behavioral at all. Sometimes those changes are triggered by pain, anxiety from a physical issue, or even a reaction to a hidden infection. If you're ever in doubt, call your vet and ask. Describe the behavior or symptom in clear terms. You don't need to wait until something is bad enough. Most vets would rather see your cat early and treat a minor issue than deal with an emergency that could have been prevented. And if your gut says something's wrong, even if you can't explain it, trust that feeling. You know your cat. If you're seeing changes that feel out of character, even subtle ones, don't brush it off. Your instincts are often more accurate than you realize. Cats speak in signs, not in words. Learning how to read them can save you panic later, and can literally save your cat's life. If this helped you understand what to watch for and when to take action, subscribe. Because every cat deserves a chance to be heard, and every cat owner deserves to know exactly what to look for.